Question 3 is this. What is nail psoriasis, and can you tell me what to look for in my client's nails? Psoriasis of the nail mainly occurs in those who already have psoriasis of the skin. Typically, about 5% of those with psoriasis will have visible symptoms on their nail plates only, whereas nail psoriasis is seen in about 75% of those who have psoriatic arthritis of the fingers and the toes. There's no cure for nail psoriasis, and the visible symptoms may come and go and then reappear for no obvious reason. Nail psoriasis can create dysfunctional nail plates that peel, break, or split, or may be more susceptible to nail infections. It can also alter the appearance of your toenails and fingernails. They may appear to be thicker, they can change shape, color, or it may feel tender and painful. Nail psoriasis is not caused by pathogens, so it's not infectious and it cannot be transmitted to other clients. The causes are not well understood, but it's known to have a genetic basis and tends to run in families of all races. Those with parents or siblings who have psoriasis, they run about a 20% chance of developing psoriasis as well. What does nail psoriasis look like? Here are 10 things to watch for. Now, any of these by themselves could be related to a dozen different conditions. But when several of these appear together, it would be a good idea to recommend that the client show the nail condition to a medical professional, preferably a dermatologist or a podiatrist. 1. Underneath the nail plate, the nail bed can develop a discoloration that looks like a small drop of blood or oil underneath the nail plate. These are called salmon patches, or in Europe they say salmon patches, due to the pinkish salmon color of the spot. 2. Besides nail bed colorations, the nail plate itself can become light green, yellow, or even brown. 3. Small pits may develop on the surface of the nail plate as the nail cells flake away from the surface. These pits can appear randomly scattered, or they may appear in straight lines or rows or symmetrical clusters and may have the appearance of small pin pricks in the surface. 4. An unusual surface roughness that gives the nail plate the appearance of being filed rough when it's not been filed at all. 5. The thickness of the nail bed can have a thickening of the nail bed. It can appear like it's getting thicker because you get a buildup of chalky white material underneath the nail plate. 6. Separation of the nail plate from the nail bed, which is known as onycholysis, usually starting at the hyponychium underneath the free edge and slowly extending backward toward the eponychium. This type of separation can lead to nail bed infections as well. 7. Crumbling of the nail plate at the free edge. Usually this is due to the nail plate becoming more brittle. Also, the plate may appear to become thicker as the layers of the nail plate begin to separate. 8. Splinter hemorrhages on the nail bed, which appear like tiny black lines running with the direction of nail growth. Splinter hemorrhages occur when tiny capillaries in the nail bed break and leak small amounts of blood underneath the nail plate. 9. Redness of the lunula can also occur if the capillaries in the lunula area, or the moon, become congested or rupture. And 10. Nail psoriasis may also create inflammation of the skin around the edges of the nail. This condition is known as paronychia. Now, it's safe to cover up nail psoriasis with nail cosmetics, including UV gel manicures or any other type of enhancement. How can you prevent nail problems related to nail psoriasis? Tell the client that they should keep the nail plate trimmed short and file the free edge smooth. Those with this condition should wear gloves to protect the hands while cleaning or doing any other kind of work with the hands. They should also use a high-quality skin conditioner to prevent the skin from becoming too dry, and this is especially important during the winter months when the humidity drops. They should wear comfortable, well-fitted shoes with enough room for their toes, especially when they're exercising, so the toe has plenty of room to move around and not hit the front of the inside of the shoe. Wearing artificial nails can protect the nail plate from becoming even more damaged. Now, one thing to be aware of is the potential for a Koebner phenomena skin reaction, since this condition can occur in those with psoriasis. I discussed the Koebner phenomena in the last episode, so please go back and watch that important episode and make sure you understand this information. It's very important. Now, several medical treatments are available, but these are not always effective. It depends largely on the severity of the disease. In severe cases, medical professionals can prescribe certain medications that can significantly improve this condition. So be sure to refer your clients to seek proper medical advice. Because the nail plate takes months to grow, it can take months before any improvements noticed, but some of these medications can be very effective. Interestingly, the medical profession often uses phototherapy, which exposes the skin to UV energy to treat psoriasis. These treatments expose the skin to many hundreds of times more UV than does a UV nail lamp. So exposing the clients to a UV nail lamp is not likely to produce any healing benefits or effects. This is why UV phototherapy treatments must take place in a doctor's office or in a clinic. There are about a dozen prescribed medications that may be injected into the area or taken orally or applied topically that may help, but only a medical professional can diagnose any type of psoriasis or provide any kind of therapeutic treatment.